Welcome, everybody in the Latin community. We are so happy to be with you this afternoon and to have the opportunity to present in our language. One of the more important things that families with children with special medical needs need. And we're going to be talking about the transition from a pediatric to an adult-focused model. My name is Rosiani Sanchez, and I am the National Family Voices Program Director. And Gianni here from Puerto Rico. And I know there's a lot of people from Puerto Rico here. And we are going to be presenting the family guide today. Giannini, my colleague, is going to do the presentation. Good afternoon, everybody. As Rosiani said, I am Giannini Lopez, the Family Voices Coordinator in Puerto Rico. And we are also the Puerto Rico Family to Family Support Center, and I am the coordinator. There are also several people here who work on this project today. We have Vanessa Rodriguez from Family Voices, and we also have two people representing Got Transition, which is an organization collaborating with us during this process. So we want to welcome Annie and Peggy. And before we begin, we do want to make an announcement that this project is supported by help from the Health Resources and Services Administration, HRSA. Let's talk about Got Transition. They are the National Resource Center for Health Resources on the healthcare transition. And they are also the program for the National Alliance to Advance Adolescent Health. And their main goal is to improve the transition from pediatric to adult care through the use of innovative strategies for healthcare professionals, youth and young adults, families, and caregivers. And for those of you who don't know Family Voices, we are a national and grassroots organization and network of families and friends of children and youth with special healthcare needs and disabilities. We are connected with a network of organizations across the United States, including families that represent a geographical, language, and cultural differences to improve healthcare services and policies for children with different kinds of special needs and disabilities. We're an organization that coordinates with the family-to-family health information centers. These are family-led centers funded by the Health Resources and Services Administration, HRSA. There are F2Fs in all 50 states, including the Washington, D.C., 5 U.S. territories, and 3 nations. Each F2F is staffed by highly skilled family members who have experience and understanding of the challenges faced by families of children and youth with special health care needs. In addition, F2Fs also assist providers, state and federal agencies, legislators, and other stakeholders to better understand and serve CYSHCN and their families. And now I'm going to turn the floor over to Giannini Lopez. Wait, hold on right before I forget. Where are the F2Fs? How do you find them? You can find them on our website at familyvoices.org, and you can click on each state and you will find information about that state. And now I turn things over to Giannini, who can explain simply and straightforwardly what the healthcare transfusion is. As Rosianne mentioned in the introduction, I'm going to talk a little bit about the healthcare transition, ACT, what is involved in the transition from pediatric to adult healthcare services. And the methods involve increasing the capacity of the young person or the adolescent to manage their own health care and effectively use health services. Once they can use these health services effectively and have an organized transition gradually and successfully from pediatric to adult services. That is the idea. The evidence has shown that a structured ACT can lead to improvements in the patient's health, their participation, their quality of life, and adherence to care, and also improve their patient experience and their satisfaction with services received, and gives them time to evaluate the different alternatives that they have for healthcare and to choose the ones that they prefer, which also leads to better satisfaction with the services that they receive. And then as far as utilization of care, there will be a decrease in hospitalization, shorter lengths of stay, and increase in visits with an adult provider and more continuity of care in the transition from pediatric to adult care, especially if it's carried out gradually and organized and in a structured way to enable this continuity in care. The American Academy of Pediatrics and the American Academy of Family Physicians and American College of Physicians recommend that all youth with and without special healthcare needs receive a structured healthcare transition process. However, we have data nationally that show that systemically that young people with special needs do not receive the support they need for this transition. And this is from a survey with young people from 2016 to 2020 that shows that 60% of special needs kids and 80% of non-special needs kids do not receive preparation for the transition. On this survey, most report barriers to the transition. They're not prepared to find a new doctor, anxiety because they have to leave their pediatrician, difficulty in finding a new adult physician, and also to adapt to the adult healthcare system. And that is why the 6 core elements of the HCT have been developed. So let's take a look at these 6 core elements of the healthcare transition in this diagram. And this is a summary of the 6 core elements. This approach has a set of steps that lead to a successful healthcare transition. The goal of these elements is to help health professionals and providers to increase the capacity of young people to manage their own health and to use services safely and with confidence. As we can see, that working on this set of elements as young patients and healthcare professionals helps the transition to go smoothly from around age 18 to the early 20s. So now we're going to show you a video which is in Spanish, and we're also going to see if we can include the link to the version of the video in English. And this explains what the transition is all about. For many young adults, the transition to adulthood and going to college and finding a job and take care of yourself is what it involves. This can be exciting, but it's also challenging. A transition that perhaps hasn't been thought about is the transition in healthcare, or HCT, which means transitioning from pediatric to adult medical care, where you are in charge of your own healthcare. This is not a one-time event. It is a process that may take several years. Learning about your own medical history is the first important step. Ask your doctor how to get access to your health information. An important part of the HCT is to learn how to manage your own health and health care. First, you can learn to make your own medical appointments, get your own information, and talk to the doctor by yourself. After you turn 18, your doctor can only talk to you directly about your health. Your health information and medical records will be confidential. It is on you to make your own health decisions. You can decide, for example, if you would like your parents to see your records or be in the appointment with you or not. A pediatrician. HCT also means going from a pediatrician to an adult doctor. This happens somewhere between the age of 18 and 21. Some people see a primary care doctor throughout their lives. If you do see a primary care doctor, you may have to talk to them about changing to an adult model so that you can take charge of your own health. To plan this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask when you need to leave their practice. There are sound problems, and how to find an adult doctor. HCT has to do with independence and empowerment. Be proactive. Find an adult doctor that accepts young people in their practice and your insurance. And don't forget to recommend that your friends also be proactive in their healthcare transition. To get advice and resources from in your transition and to make it as easy as possible, go to gottransition.org. So the video gives a lot of information and summarizes everything we must do when we begin a transition and all these steps that are in this guide. It's all spelled out and detailed here. And what we want to do is make this guide, this family toolkit, available to all families, not just for families with a special needs child. It can also be used to be shared with other people who need this information. I'm a mom of twins who are 7 years old. And this family toolkit will help you to slowly work through the transition and start early on. And it will help you to take the steps in due time. So we also want to present this family toolkit completely in Spanish for Spanish speakers. It is not a translation or a traditional translation, because you know that sometimes translations aren't exactly what we expect, but this toolkit or Guía para la Familia was edited by family leaders to make it a little more specific for the Hispanic community. And so we are very pleased to present this to you. We are going to be sharing our presentation with you after this meeting, and you'll be able to access all the resources that we mentioned. So don't worry about having to take notes or taking screen grabs. We are going to share everything from this presentation with you. This toolkit was developed to empower families with when and who and how to go through this transition from pediatric to adult healthcare. The toolkit is available for adolescents, young adults, caretakers, parents, and healthcare providers who work with these patients. And these resources are available through the Got Transition website. And again, we are going to be sharing everything with you. This toolkit includes a series of different resources that help parents and the child understand and learn to be ready for the transition and where they need additional support. So we divided the toolkit, which is quite long, into key questions so that you can go through the main content. We don't have time in this 1 hour session to go through every single thing, but we will have about 15 minutes for questions and answers at the end of the presentation. The first key question is, how should we start talking about the transition with our children? The timeline is in the toolkit with helpful steps, and it is a visual timeline because some of us are visual learners, and so you'll see this diagram that classifies the transitions by periods, and I'll show this to you, which has the different steps depending on the age that the family decides to start working on the transition with. We recommend starting around 12 years old, and the transition ends really around 25 years of age. And this really depends on the child's cognitive level and when they're ready to transition to working on their own, depending on their medical condition. So the transition may start either a little earlier or a little later, depending on the individual. One of the important areas that is talked about during the HCT are, what are the recommended HCT services? What steps should we take with our young people for a structured and effective transition? As we already saw, the American Pediatric Association suggests that the transition planning begin at the age of 12, so that it's good for parents to start working actively from the age of 14 to 21. Parents and physicians can help teens and young adults learn to handle their own health care. They can learn to make an appointment or pick up a prescription or get access to their medical chart or ask questions, and have the young person run the conversation and ask their own questions of their provider. The planning for the transition can include asking the young person questions about taking care of their own health and also coming up with an emergency plan. And once the transition finishes in their early 20s, or maybe even as early as 18, they will be able to handle this themselves. And you can see on the timeline here that there are certain ages where we should be supporting our child in the transition. For example, from ages 12 to 14, we should begin to discuss the transition plan and talk to them about what they need to do and will do, and start discussing the plan and the steps for a successful transition with them. And we saw this in the 6 core elements that doctors should also start to talk about this with their patients between the ages of 14 and 16. Children can start making their own doctor's appointments and order prescription refills. They can actually call. This may seem simple, but it is a very important step in the transition. Among other tasks that young people can take to be more self-assured and more mature is to begin understanding what their own needs are and taking care of them. What questions can my child and I ask our doctor about transitioning to adult care? On pages 6 and 7 of the toolkit in Spanish, there, you'll find questions that you and your young person can ask. I just saw the request to go a little more slowly. So on pages 6 and 7, here's a screen grab of what you will see in the toolkit with questions that you and your adolescent can ask the doctor. And even before you make the first appointment with the adult doctor, to begin the conversation about the transition. So to start with these questions that you'll ask the pediatrician and the adult doctor, even before you make the first appointment to a new adult doctor. What are your office hours? What services do you offer? Do you offer the ones I need? And to ask these questions before the first appointment is made. And to also, what will I need at the first appointment at the adult doctor's office? Will the pediatrician transfer my health records to the adult doctor, etc.? The toolkit also has questions for the young person to ask the doctor, and also for the parent or caregiver to ask the doctor. There's another section in the toolkit is on page 8. How does my role and my child's role change, or the caregiver's role change throughout the transition process regarding services and their access? And yes, we do expect that the roles will change. You can see in this picture how parents' roles change and are transferred over to the young person. The parent or caregiver's role is to support a gradual transition to make sure that it is harmonious and structured. So this role change in a role from a caregiver to an advice giver or consultant is important. And this also means that the child can gradually become the leader and take the lead in their own care. And during this process, there is shared management so that these roles are changed gradually and little by little are turned over from the parent or caregiver to the young person. And both parties can take part in this. Another important aspect to take into account in the transition are the legal changes in healthcare at the age of 18 or 21. The legal age of adulthood depends on the state. So this is what we mean when we talk about what it means to become an adult legally. And the toolkit on page 9 talks about what it means and some recommendations when you become an adult. When you turn 18 or 21 and become a legal adult, there are changes that happen in privacy. Now a young adult is the owner of their own information. And so this also has to do with confidentiality, decision making, and sharing medical information. And it also, so page 9 has some, and it's page 11 in English, has important information so that young people can realize that this is a change that will occur and what will happen when they become a legal adult. Rosiani, another important topic is what the differences are between pediatric and adult services. Sometimes we don't know what the differences are or when they should start. So let's look at that. In the toolkit, it shows what the differences are when you transition from pediatric to adult services. And this also involves the insurance companies. The young person can read these changes and they can circle all the ones that they have concerns about and talk to their doctor about them. And also you as the parent or guardian can also read what all the changes are that are going to take place when the child becomes a legal adult and how to prepare for them. The toolkit presents different scenarios and all the different things that will happen during the transition, and it also provides some forms that you can fill out about what you're doing, what you need to do to ensure that the young person is prepared for this change. Giannina, you're the next one on for this question. This is the next section. How ready is my child to transition to adult care and manage their own health and health care? So let's learn about what resources we have to answer this question. As Rosiane mentioned, the toolkit has these pages in English from 16 to 23 that are a readiness assessment for the young people. And you can fill out this assessment starting on page 16 because you as the care giver or parent can fill out the caregiver parent version, and the young person can fill out the young person version. There's 4 versions, one for young people, one for parents and caregivers, one for young people with intellectual disabilities can fill out, and one for the parents and caregivers of young people with intellectual disabilities. And this is a web screen share of the page for where young people could fill out the assessment online. And to assess their readiness for the transition to adult services. The good thing about this online version is that you'll know your results immediately based on your responses, and it also offers recommendations based on the needs that come out in the assessment and explains these steps to take based on the needs discovered so that the young person can go through the transition based on their own needs. So in the section for youth, in the Got Transition webpage, you will see a number of resources, and you can see one which is an online quiz that they can do online. The Got Transitions website that also has a lot of important and interesting resources that complement the toolkit. You can also go into the parent and caregivers section of the site, which includes other resources for you as caregivers. And you can see that most of these are also available in Spanish, which includes the family toolkit, the guide that we're talking about today, and complementary or supplementary resources for going through the transition as a family. Giannini, I'd like to add that since the titles are in English, for people who only Spanish speakers, if they have trouble accessing this, we put the website address at the bottom of the slide. So you can just click on that, and that's a direct link so that you can find the resources page more quickly once we send you the presentation. Because each slide also has the link to go directly to the pages that we're talking about. We'd like to wrap up talking about additional resources. So there's the Family HCT Toolkit, and we're sharing, again, as we mentioned, all the links in English and in Spanish. And you'll also have links to the video that talks about the different stages of the transition and explains what the healthcare transition is. And this is all in English and in Spanish. And we also included the official Family to Family webpage. If you need additional support, you can go to your local F2F to ask for that assistance. We are not the biggest experts, but we have studied the toolkit. So if you have any questions, we are available, and here's our emails. And we're including myself, Giannina, and Annie Schmidt. And some of these people have been involved in the development of the toolkit. So if you have any questions, we are here to help you answer those questions. So we did really well with the time, Giannina. So we do have 15 minutes for Q&A. So now you can, I believe, directly ask your questions. You can unmute and ask questions. And if you speak English, you can also ask your question in English and it will be interpreted into Spanish. So if you have any questions, you can also write them in English or in Spanish in the chat. Giannina will be reviewing the chat. We will also be sending you a link for a really important survey that we would really like you to complete, to have you tell us how we did, what we can do to improve, what we should include, what we should not include. Vanessa, does anyone have any questions? I'm going to stop. Thank you, Rosane, in the chat. Several have asked for the presentation and the recording. And yes, we will be sharing these resources, and someone saying that this information is marvelous and it is good even for children without disabilities. And Mariela says,
Peggy, I wonder if you want to answer this question.
Annie, would you like to answer this question, or Peggy? Annie, go ahead.
So I'll let Peggy answer it if you want to unmute yourself.
Thank you so much. The public policy directed towards healthcare transition in all the states and in the jurisdictions, there's a Title V program for children with special needs, and 36 of those states have selected transition as a priority. And I know Puerto Rico is one of those states. The state agencies have been working very thoughtfully about how to implement policy, improve policy for transition. In addition, I would highlight that the clinical report that Rosani and Giannina referred to by the AAP, the AAFP, and the ACP represents what are the kind of clinical policy recommendations. Thank you.
Thank you, Peggy. Vanessa, do you have other questions in the chat? Karen Paso says that my 20-year-old began the transition in clinical therapeutic care and psychiatric care at the beginning of the pandemic. There were problems in providing medical providers, and there was a long wait. I don't know if we can continue with her same or his same care until we can find new providers. I didn't accept this situation, and I continued this continuation because we couldn't find new providers. He doesn't speak, he's like a baby. And he turned 18 on January 4th. I don't know where you live, but if you're in Puerto Rico, you can contact Family to Family in Puerto Rico or wherever you are, because there are Family to Family centers in every state and territory. Whatever you prefer, and I can help link you to them. but the familyvoices.org will help to hook you up with your state or territory family to family center. Or you can write to me and I can help to hook you up. It looks like you're in Virginia and help you do that. Joanna is in Virginia, so if there's someone who can help her there, hold on a sec. So there's a question in Puerto Rico. Is there more than one criteria or definition for being of age? Is it the same as in other places? In Puerto Rico, it's 21 years of age. You become an adult. In Puerto Rico, no, most are 21. Puerto Rico, it's actually 18. This is Corley. I didn't explain it well. There's a difference in healthcare in terms of becoming of age. For some, it's 18, for some, it's 21, and it's not completely defined. So that's why I have this doubt. And there's the same thing happens in some other states where there's this difference or lack of clarity. Do you know about other states that divide health care into different ages for coming of age?
I'm happy to answer that. I think most states, depending on the program you're in. So if you're receive health insurance from a Medicaid program, you're aging out either sometime at 19, 21, 19, 20, or 21. And that's when you end your childhood status. Now, again, it depends where you live. You may be able to continue on Medicaid through a disability path or through a low income path. But it's typically between 19 and 21 that there's a cutoff. And then if you rely on the Supplemental Security Income Program at age 18, you have to meet adult criteria, which are far more restrictive. And again, in the state Title V programs, they have different ending points as well. So it's really important to understand when you're going to age out of these programs.
Did we answer your question, Coralaida? Yes, you did. Great. Are there other questions about the toolkit? Most of them are comments. Pediatricians will see you until 21, but when you turn 22, pediatricians won't see you anymore. And then most states, the adulthood begins at 18 years of age, in Georgia too. For Joanna, you can also get information about the Title V program. Those are the comments we have. And the experiences that a mother shared. It's difficult in Puerto Rico because of that experience about the differences with ages. Then there's a lack of transition services. And that's was also evident in the survey that was shared at the beginning, that 86% of children do not have information or tools available to help them with the transition, whether it's led by the provider, the parent, caregiver, or the young people. But the transition planning should begin at the age of 12. It's a complicated process, and in order to ensure continuity of services and ensure that once the young person turns 22, that they don't lose continuity of care. That's why the toolkit lays out the steps to take to ensure that the transition is completed once the young person becomes a legal adult. In the chat, they're sharing that before that, the transition should be worked on before, because the pediatrician really cannot continue to take care of someone who is older than 21. And you need enough time to find a primary care physician. And depending on the situation of the young person, you need to find a good doctor who understands the young person's condition and to find the quality of care that's similar to what the pediatrician was providing. So this can take time. And that's why the toolkit goes through these things step by step. And there are a lot of parents who are involved in the transition, who have children like some of yours who may not be verbal, etc. And the parents are going in those cases to continue providing care. And the toolkit will explain how to help these young people be as independent as possible and help them to be able to do the things that they can do for themselves. And even though they may not become fully independent, but how in those cases the parent or caregiver can continue to help out. I wanted to say that most pediatricians in Wisconsin accept adults until they turn 26, because that's the age that young people can no longer be included on their parents' health insurance. That's another limiting factor, is when you can no longer be on your parents' health insurance. Any other questions, comments? And we have shared our survey link. In the survey is in English and Spanish. It's very short. It won't take you long. Please fill it out. This is an evaluation of this session. We really want to hear you. And Coral Laide says that yes, medical insurance is another factor. It makes sense to make your healthcare transition not at the same time you are changing insurance. And you want to make sure that your decisions are as informed as possible. And you also want to make sure that you are dealing with up-to-date information. When you share information, that's the information that's on the website. It's up to date. Please share it with other people. And if the information does help you, please share it. Share it with all the families you can. It's all available free, and it's available in English and Spanish. One of our participants said, this information is also good for completely so-called normal children. And in Puerto Rico, where the tradition is to stay with your parents until you get married, it's still important to go through the transition. And there's the web address for Go Transition also is in the chat. We still have more time for questions. Yes, our culture We do have some things in common among different Hispanic groups. We continue to depend on our parents and count on them, even though we are adults and we are responsible for our own health care, but we may still invite our parents to the appointment with us. And parents don't completely stop acting on our behalves. And we can still do that. And we can still do this even though we are independent, because we can use our parents and caregivers as consultants to help us. But we want people to become independent and empowered in terms of taking control of their own health and health care. We will be sharing the presentation, and you will. Oh, he's growing up. And if you have any questions, we are available. Please, we would like to thank Go Transitions, and we would like to thank you all for being here. Susan, thank you very much for interpreting during our call. It's always a pleasure. Thank you all. Please don't forget to do the evaluation survey. Thank you. Have a great afternoon. See you all next time. Thanks, everybody. Thank you for presenting this information.